Hello, everyone. Welcome to this final presentation of our team's Design Thinking for Social Change project titled How is Your Soul Today? Navigating Faith and Spirituality in Care Work. Our team consists of Andrea Doan, Ben Lukinchuk, and myself, Lavjay Bhutani. Medicine inherently is a spiritual profession. In the words of a palliative care physician, Christina Pushalski, patients learn to cope with and understand their suffering through their spiritual beliefs or the spiritual dimension of their lives. It is also through that dimension that I think the compassionate and caring part of the doctor-patient relationship is enacted. Yet there appears to be a disconnect in the teaching and practice of spiritual care, which are core elements of cultural competence and humility. Let's take a moment to look at this slide, which came from a recent study from the Pew Research Center. This study highlights the fact that 9 out of 10 adults in North America believe in God or the existence of something that is spiritual. Recognizing this, it should come as no surprise that most seriously ill patients use their spiritual and religious beliefs to cope with their illness. It's also interesting that even among patients who are healthy, the vast majority who rate themselves as being religious or spiritual want to talk to their physicians about their beliefs. And even more interestingly, 50% of those patients who do not rate themselves as being very religious or spiritual still want to be asked about it by their physician. There are many studies, again, that confirm that patients do want caregivers to address their spiritual needs in a variety of different healthcare contexts, and that when this is done and when their needs are addressed, patient outcomes measured through patient satisfaction, their well-being, and symptom control such as pain management are improved and much better. Yet the reality is that patient-reported spiritual care from medical teams ranges from as low as 9% to only about 51%. And when asked, only 10% of physicians state that they inquire about patients' religious and spiritual beliefs on a regular basis. While there are many data that have identified potential barriers, let's hear in the voice of some of our stakeholders of what their perspectives are. When we did empathic interviews with a patient, this is what we heard. I'm not necessarily looking for spiritual care, but, well, it does depend upon the context. Experiencing a crisis or being admitted to the hospital may be a more appropriate context for me to seek such care, especially if I have a pre-existing relationship with the doctor. I do feel comfortable talking about my spirituality if asked by a physician. A spiritual care provider can help coach me through a situation. When we spoke to a physician, we heard, you know what, I don't have the training or vocabulary to ask such questions, and I fear saying the wrong thing. But it is important to explore this aspect of patients because it's not about changing beliefs, but about understanding a patient more holistically. And I recognize that chaplains are not readily available and are mainly used for crises. When we talked to a chaplain, we heard that there is a lack of understanding of what a chaplain is and what they do, and there's often a misconception that chaplains have a religious or conversion. And so based on this and our own empathic interviews, we developed our how might we question, which was how might we create a safe place and space for patients and healthcare professionals to start conversations at the intersection of healthcare and spirituality in a hospital context. How do we build a connection? How do we give a message to patients that this is a safe space for religion and spirituality to be discussed? And in other words, give them an opening, so to speak, to those who may be reticent to engage in such discussions, recognizing that at the back end, there are many other things that would need to be done, such as training of physicians and healthcare providers on how to actually carry out such a conversation. And with that, I will hand this over to my colleague, Ben.